Good afternoon. Welcome.
Hi there.
And welcome to the BPA Quality Healthcare Elevating Healthcare Customer Experience webinar. This is a encore event from last week. We wanted to get our message out there to as many people as possible. And so in this new platform, because we used a different platform last week, you're able to offer up any comments and ask us any questions during the process. But as we start, I'm going to go ahead and add our presentation. But to start off, does anybody have any housekeeping items that they'd like to include or add to our comment section here? All right. I guess we did everything right,
I
Christine,
think so. No comments
inviting
yet,
everybody.
but please feel free to use our comment sections throughout or just jump in, ask some questions.
Absolutely. So, welcome everyone, and thank you for joining us today. We are excited to discuss elevating healthcare customer experience. So, we're balancing innovation, psychometrics, and the human touch for better customer and patient outcomes. So, we hope to make this interactive and welcome your comments and questions during our time together. We'll be discussing using tech to improve our interactions and reminding ourselves that we should not forget our people in the race to digitalization and AI. That's such a hot topic these days, don't you think?
It is.
So here we want to introduce ourselves. First off, I think we'll go to, let me introduce myself and Christine. I'm Karen Dupree, Senior Director of Quality Solutions at BPA Quality. I have over 20 years of customer service and quality experience spanning from in-person guest relations, call centers to customer experience and psychometrics content contributor via blogs, podcasts, and everything social. And on to Christine.
Hi, everyone. So I'm Christine Clarkson. I'm the Vice President of Healthcare Quality Solutions, and I have over 20 years of healthcare experience, including working with PBMs, with specialty pharmacy, 340B, drug distribution, disease state management, patient assistance programs, the full gambit, and then of course, with patient care. So I'm lending my expertise, in healthcare to speak with you all today about elevating, the patient experience, and we're certainly excited to share our insights with you today.
Great, awesome. So on to the next, just a little bit about BPA Quality and why we are the experts in when we're talking about customer experience and with the contact centers agents, is that we've been around doing this for over 30 years. So we have 30 years of experience in contact center quality monitoring, training, and consulting. We are ICF members, and I am proud of our CPD, which is Continuing Professional Development Certification status. So you can kind of get a feel of, what our qualifications are and what we stand for in the healthcare industry.
Yeah, and we also work with all global brands, across various, sectors, including telecom and technology, travel, and of course, healthcare there. And we work to deliverable, actionable insights and enhance, that customer experiences. And we're also, fully HIPAA compliant as well.
Exactly.
So let's move on here and kind of look at, what we're going to cover today. So we're going to look at, how to improve patient outcomes and maximize, moments of truth, balance digital and human experiences, and explore the current healthcare landscape. So the what is, we're going to look to review the current challenges you're all facing. How are you balancing the digital and automation activities, with that human element as well? And then, so what? Why is this balance needed? How much of a balance is needed? What tools are needed for this balance? I'm sure you've all been asking those questions as well. And then finally, the now what? So we'll look into how to improve your patient experiences. We'll dive into customer experience innovations, the role of psychometrics, why it's important for that human element, leading to more meaningful patient interactions. We'll explore why empathy and personalized interactions are crucial in healthcare and how they can significantly impact, patient satisfaction and patient outcomes as well. So as you all know, healthcare faces significant challenges, that impact patient experience. And the challenges include, disjointed transactional experiences, long patient call wait times, complex layers for the patient with insurance payers, that are driving the networks, authorization steps for therapy. I mean, you've all seen all of that. Um, there's fragmented systems, that are often requiring patients to, repeatedly provide their medical history, and that leads to disjointed care. There's inefficient scheduling causes frustration and delays, and additionally, staff frequently feel restricted, in their own decision making abilities, and this negatively affects quality and patient satisfaction. And this is all leading to an overall perception of a lack of human touch and care. So all of these challenges add to patient frustration and dissatisfaction. A crucial part of any patient journey, is healing, and is dependent on how we are made to feel. Therefore, addressing these types of issues, is really crucial in improving the patient satisfaction and those patient outcomes. So if we move on, and really looking at moments of truth, so every role in healthcare impacts the patient experience, and from the first contact to the final follow-up, each interaction is a moment of truth that shapes that overall patient journey. Recognizing that everyone in healthcare has a role in patient experiences is the first step towards that transformation. And it's not just the responsibility of doctors and nurses. As you all know, patient care coordinators and every team member involved in administration of patient care are equally important. But each role significantly shapes the patient experience, as they can call on impact on these moments of truth. When patient coordinators focus on patient-centric interactions, during patient contacts and with the medical professionals, providing empathy at that point of care, the entire patient journey will improve. So every interaction from the first phone call to the final follow-up contributes to patient satisfaction and the loyalty to your company as well. So you have to think it more of holistic from that very first start of the call to the actual follow-up and the end of it.
And one thing that follows up on that is, with those moments of truth, every piece of that interaction, every section, every time that your agents are interacting with a customer, is something to keep in mind on KPIs, or what that journey looks like. But in the end, what your ultimate goal is to how you made that customer feel. How did you make that patient feel after that interaction? And this is a great quote that I absolutely love, and we use it in a lot of our training courses as well. I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel.
Yeah, and that's
And
so true.
it is absolutely 100%. Doesn't matter who you are and what type of interaction it is.
Yeah, totally agree with that one, Karen. So for better or worse, I mean, our patients experience multiple moments of truth, throughout their journey. It's essential to maximize each touch point to enhance their overall experience. And each touch point also gives us an opportunity to enhance the patient experience and build that patient loyalty. But, are we maximizing each touch point? I mean, what do you think? Are you maximizing that right now? I think a lot of companies and a lot of, employees and staff members are saying we're maybe not quite maximizing everything. So this is what we're going to take a look at today.
So one of the questions that we ask a lot is, does your culture and tools or solutions support the delivery of exceptional patient outcomes and experiences? Is your intent and your operation reality aligned, right? Uh, what does that mean? Sometimes you just have to stop yourself and think, does this work? Is this the process that we need to do? Is this a culture and tools that we need to use? Are we using those properly? And that goes back into what Christine shared, on maximizing each of those touch points. So What are the actual human impacts on patients and customers when you need our services? So, understanding these challenges helps us provide better care. So, you ask, what challenges do patients face? And feel free to, fill in, add any comments or share your thoughts on this as well. Well, what is the actual human impact for our patients when their circumstances cause them to need our services? So here I'm going to share a screen of what we've come across with our customers and their interactions with their customers as well in the healthcare industry.
I mean, as you all know, I mean, our patients face, a variety of challenges and vulnerabilities, including, high stress levels, time pressures, fear, and anger, at their diagnosis. And most patients, are overwhelmed with the insurance payer process and worry about their claims being paid or if they can afford the therapy and the medications. We need to identify, what detriment, harms, or problems our patients are vulnerable to. Also while noting, these can fluctuate and certainly change over time. But if we don't fully realize these, we won't be able to help them. So it's very important that we take a look at what is really challenging our patients and then how do we help in those areas to remedy it.
So, our staff faces similar pressures, leading to empathy fatigue. Addressing these issues is crucial for maintaining high quality care. As customers bring more challenging and unique needs to our agents, who now handle increasingly complex issues due to automation and self service options deflecting routine tasks, our staff can experience stress, burnout, and empathy fatigue. I know I do. As the environment change and our customers are more tolerant of contact center experiences, well, we see customer satisfaction rates at an all-time low and complaints at an all-time high and longer resolution times. So it makes me wonder how our agents are being treated. The stress of the role and the high pace can definitely lead to more absence in dealing with complex and emotionally charged cases. So, what's your experience of the way customers speak to our people? How well do we train our team to diffuse this tension and manage difficult customers?
So it certainly bears repeating that we talk about, patient vulnerabilities, but our team members, often face the same pressures, we've outlined, and they're still expected to show up for patients when often experiencing, similar circumstances or supporting, someone who does. So it certainly cuts both ways, and patients can run the risk of, dehumanizing, our patient care coordinators because they simply, cannot see the job, our team has to do behind the scenes.
So, empathy is key here to doing the right thing for all patients and customers, particularly when vulnerability is present. We already know this. Keep empathy in mind as we will speak more about it and how it ties into psychometrics. Empathy is crucial for connecting with patients and customers, especially during challenging circumstances. It's the cornerstone of effective patient care. And here I would like to just let folks know that this is a series of for healthcare customer experience, and we actually have empathy as our main topic for tomorrow's second part of the healthcare webinar series that we're producing here.
So sign up for tomorrow. You'll learn more about empathy.
Yep. Whoops. So offering quality customer service and patient care increases satisfaction. Despite digital advances, patients still value human interaction. It is essential to keep the human touch alive. Offering quality customer service and patient care is one of the ways to increase patient satisfaction. In this era of digitalization and automation advances, healthcare companies must ensure a human touch to their patient service. patients and customers are still wary about foregoing human interactions during their care journey. Patients and customers generally feel that their medical needs are unique and unable to be addressed to their satisfaction by algorithms or other technologies. When I'm struggling, confused, or vulnerable, do I want to speak to a robot? Not really.
I know I don't. Nope. I can never get through the robots.
Exactly. I don't know how many times I've screamed at an IVR, but
Representative.
investing in tech can be overwhelming. At BPA, we focus on human-centric, tech-enabled approach to ensure seamless patient experiences. So with tech investments can feel like buying a fighter jet without knowing how to fly it. I don't know how to fly it, and that's a very expensive toy for me to have just to be sitting in my front yard. So we help you navigate these challenges effectively.
And I think a lot of companies do that. They'll buy that piece of technology and they've sat through the sales presentations and it has all these bells and whistles and, oh yes, I need that and I want that and I can do this with it. And then once you get it, you really don't know what to do with it. You don't know how
Exactly.
to program it. You don't know how to set it up for um, your
Patient.
center and your processes, and you're just not getting the value from it. So this
Yeah,
happens, I think, very frequently.
absolutely. And it can be overwhelming, like you said, and expensive to
Hmm.
navigate these intricacies.
Exactly.
And one of the things is that we have folks on staff that's all they do is manage high dollar amount tech to make sure that it's working for your company. So if we get it wrong, we can end up with a disjointed, robotic, and transactional experience, and that's definitely not what we want. So partnering with experts can deliver the results you have invested in. So, delivering on these, there is a growing variety of ways that tech can help us. So we all know about speech analytics at this point. Now that AI is coming into the forefront, the use of it in identify contact drivers and process improvement opportunities and training needs. So there's a lot of it. They're great tools, it's just knowing how to use those tools and use those tools to the level that you get that return on investment, right? So if it can help patients to self-serve that when there is a preference and can help write summary notes for advisors, lessening wrap-up time, not to mention enhancing knowledge bases and speed to competency or efficiency in a role for our team members. So our tech users in operations and manager roles have historically spent hours analyzing calls, email, and chat transcripts. The new wave of AI are already providing excellent at processing batches of text. Any business process where there's a lot of messages, content, text, communications, will see the benefits of technology and what one of our partners call homology for customer outreach. And customer service is front of line to reap the rewards. So we can kind of talk about a little bit about the different tech-enabled approaches that you can see here. So we have digital self-service automation, speech analytics, chatbots, data analytics, knowledge management systems, artificial intelligence, and workforce management, just to name a few. And I don't know if anybody that's watching or would like to comment, are you using any type of technology right now and that I didn't list above?
No comments yet, but
All
I'm sure
right.
a lot of you are using, some of these or maybe all of these, and maybe some in addition to these.
Yep. We're looking at investing in that in the future. So,
Hmm.
so with that said, every conversation with a customer is a lot more than just it's an opportunity to make a real connection, to build the human element. As humans, unlike bots, we can be creative, intuitive, show real empathy, feeling, and understanding. To connect on a human level, it is critical to connect at the human level for patient satisfaction.
Mhm.
So, and here we can kind of look through the, AI like speech analytics is excellent at providing breadth and quantifying how often a scenario or behavior arises. This technology can be used to measure specific elements in all recorded interactions, but typically uses a narrower scope. So, mostly focused on procedural adherence or other binary measurements that these tools excel at. So, human listening is very powerful on its own, but typically limited in scope. Expert human evaluations can provide more complex analysis of situations and both customer and agent behaviors. Using the combination of the two, which is ideal, of the two typically leads to the most powerful results. So, using speech analytics to determine how often a situation is occurring and in which markets, areas, demographics, etc., then using expert human listening to provide the deep dive root cause analysis and recommendations for improvement in handling that scenario either through people, process, or technology enhancements. So it's increasingly about understanding where the human intelligence and machine intelligence intersect. And this is where we excel.
Mhm.
Once issues are identified, the analytics strategy is deployed, triaged, and prioritized, is done in tandem with the client. So next is an analysis of relevant data is undertaken by our psychometricians and data scientists. Project plans are written to determine the depth and breadth of identified issues and how we intend to approach it. Research into client processes, tools, training, etc., is considered as part of this analysis. So hypotheses are tested in the speech tool, followed by investigated listening, where we can determine root cause driving the identified issue and then correlate those findings to the other analysis. So it's good for many things and quantifying how often something happens. So we kind of went over that and how we can glean from the evaluations, call data, CSAT data, etc. What steps in the process are being omitted. And that's where we go to the next
All right,
level.
psychometrics. So, who's heard of psychometrics? Do you know what psychometrics is? I mean, are any of you using psychometrics? It's one of those nice, new, innovative buzzwords right now, isn't it? So, the definition of psychometrics is a field of study focused on objectively measuring behavior, psychological traits, abilities, attitudes, and knowledge. So psychometrics, is a field of study, focused on objectively measuring, all of these attributes there. It's involved in the design and administration and interpretation of measurement and assessments to quantify various, psychological characteristics. So these characteristics, they can include personality traits, cognitive abilities, emotional intelligence, and many more attributes there. So let me give you an example of a practical application. So the starting point for psychometrics is identifying what the desired outcome needs to be, and then using evidence and as many, contributing data points as possible, which could be skills, knowledge, processes, and behaviors needed to achieve that desired outcome that was identified. Above all, it ensures that the data you're working with is measurable, objective, reliable, and valid. So you can really define your outcomes, with using psychometrics to really get the results that you're looking for, with looking at that emotional intelligence, which is usually you cannot quantify it. And you can do that with the psychometrics.
So In other words, psychometrics enhances many silos in the industry in the business level. So for recruitment, performance evaluation, patient satisfaction, and looking at your knowledge management systems as well. So you can identify candidates who possess the personality traits and skills necessary for delivering effective customer service. This might include empathy, communication skills, problem solving abilities, and resilience. Psychometric assessments provide objective data for evaluating individual performance by measuring key competencies. So it enables subjective behaviors such as empathy to be quantified. Psychometric assessments help to understand the psychological factors that influence customer satisfaction, such as responsiveness, fr- um, friendliness, and problem identifying the why behind what drives customer responses in surveys, and providing actionable intelligence that enables the development of customer experience solving abilities. So, psychometrics helps companies to provide the best knowledge management system to make it easier to find and provide the best solutions to customers throughout the interaction. So, if we all listened to the same patient call, would we be able to say the agent provided empathy well? Knowing what to look for, what behaviors influence customer perception and the outcome of customer experience. You also need to look at observing it accurately, ensuring that measurement of behavior is unbiased and accurate. Feeding back effectively. So you want to ensure that the format of the feedback is actionable and enables change. Change is important. Validating results. So identify the impact of the behavior change on customer experience outcome. This step is frequently overlooked and then becomes extremely costly. So this cycle can then be linked back to valid CSAT results, and that's what's important.
Yeah, and it's really important that you complete the full cycle on this as well, because I see a lot of companies and departments where we'll do what steps 1 through 3, and then they forget about the validation of the results. And then you go down the road there and you wonder why isn't this not working? Well, you didn't complete the cycle there. And that's really where you need to then understand is what you've put into place is actually going to be working and driving the results that you really want. And this is really where, the psychometrics comes into play as well.
Yep, absolutely, absolutely. And here, we want to talk about boosting satisfaction because it gives you meaningful insights that are evidence-based and measurable. So you can provide targeted training, trust the feedback with easier calibrations, and drive tangible business results. So these are, all important and worthwhile reasons to look at psychometrics in the full cycle of the evidence-based development of your quality program too.
So, how do we connect the dots with psychometrics? We all have data, and sometimes we might have too much data, but we all have data, lots of it that we can probably get access to. But, what does it all mean? Can we interpret it? So, we need to be able to convert and connect all of these dots from the data that we get, the information, the knowledge that we have, and turn it into insights. We need to apply our healthcare wisdom and our tribal knowledge that we have on things, so as to really make an actual impact to the patient. And this is where psychometrics will lend a hand, in this process of connecting all of those dots from just data to actually making the impact. So psychometrics, is used to drive those actionable insights to improve the patient journey and the overall patient experience as well. It really is that secret sauce to understanding, empathy and vulnerability and all those other soft skills and really how to apply them to make that an impact for your patient.
So, one of the greatest issues encountered in business is that almost anything can be proven with enough data, which is cut the right way. So, with large amounts of data delivering endless measurement in contact centers, it's easy to lose sight of how best to use it. As our access to data increases, so too does our ability to manipulate it. So, we must be mindful of the need to integrate data in a way that allows it to actually deliver the insight.
Mhm. So it's not enough to simply, want the best experience and outcome for our patients. Our patient care coordinators, they don't just know how to work with your patients in the best way. It doesn't just happen automatically. I mean, there are a set of coachable skills, that must be honed and practiced and developed. Example, evaluating, our team members, empathetic responses, should be a part of continuous improvement, for our staff knowledge, for their skill set, and really how to deliver it effectively. So there are a variety of elements, that are critical, for the success of the patient journey. And I'm not going to go through, each of these with you. But as you can see, the critical elements of what is all involved with success is, quality, compliance, of course, feedback and coaching, as well as training. There's technology that plays a role in this, as well as reporting. And these all lead to a focus on those soft skills and that secret sauce, as you all know, can lie with empathy and how it is utilized for a successful patient experience and journey. So we've got a few case studies, to really highlight customer success results that you can experience by applying, different solution options as well. So in this study, the healthcare company was seeing patient dissatisfaction with their experience. They utilized psychometrics QA and calibration along with vulnerable training targeted, to their team needs. And as a result, they saw a significant increase on calls being handled appropriately and with sensitivity by an increase of 80%. And this aligned with their goal of keeping that human touch with this ever evolving, digital world that we all live in now. In this study, the healthcare company were not promoting the offer to use their mail order pharmacy as an option as opposed to their brick and mortar facility. So they utilized, speech analytics and audits along with some training that was targeted for probing, rapport building, and overcoming objections. And as a result, they saw an 18% increase in their conversion rates over to their mail order pharmacy. So that aligned with their goal, to using technology more effectively to improve their patient interactions. And then on my final case study here, this is a technology company, and they were realizing a low first call resolution rate and experienced increased dissatisfaction due to payment issues that was identified in their chat channel. So they utilized psychometrics to really understand the root cause, and this was linked to customer identification failures in the chat. So the company was then able to identify the issue channel and those processes and made the needed changes as a result of that. So once they incorporated all of that, they saw an increase of 18% in their CSAT scores and a further 13% improvement in their first call resolution rates. So this aligned with the goal of to boost satisfaction, with the psychometrics. We've seen many different and more observations on these various adopted approaches. These have included, significant increases to conversion rates, quality scores have increased, first call resolution, and CSAT scores have increased. And they've also seen decreases in those non-compliance scores because you want those low or zero, and those high-risk calls have decreased as well. And this has really promoted a significant dollar savings due to these identified process changes and really reduce unnecessary callbacks to patients as well.
So, looking at a 360 degree of customer experiences, over the years, our solutions evolved to include these features that guarantee success for our customers. These are value add, actionable training, purposeful focus and alignment, conversational analysis, emotional management, company wide calibration, leveraging and integrating technology, peer to peer coaching, and CSAT triangulation, and advisor driven QA and coaching ready feedback. So, in our journey towards a comprehensive 360-degree view of customer experience, we've developed several key features to support our clients' success. So, we're looking at the value add actionable training, which is practical training that directly improves performance, purposeful focus and alignment, ensuring all efforts are just strategically aligned with goals. Conversational analysis, which is analyzing interactions to extract valuable insights. Emotion management, which is understanding and managing customer emotions effectively. Company wide calibration, maintaining consistency and accuracy across all evaluations. And leveraging and integrating technology, which is utilizing advanced technology to enhance processes, peer to peer coaching, which is encouraging knowledge sharing and support among peers. And then the CSAT triangulation, we haven't figured out a better term for that yet, but it works. So, combining multiple data points for a comprehensive view of customer satisfaction. And then advisor driven QA and coaching ready feedback. So we want to provide targeted and actionable feedback uh, for continuous improvement. These features help us support our clients in achieving their customer experience goals.
A lot of times you see that feedback, when it's given to the patient care coordinators is, it's not targeted. So it's more of a blanket type of feedback or coaching, and it just doesn't, end up with the result that you're looking for. So you really have to look into what are you really trying to solve here and the best way to solve it.
Exactly. So, we're coming to the end of the webinar here today. Would love to open up the chat, see if anybody has any questions before we
Yep. Any questions
close.
or comments? Anything we could explain further or anything you just want to chat about?
All right. Again, I think we're doing a great job, Christine. We're answering all the questions.
Loving it.
This is a huge topic, and this one is the one that is introducing the series. So we will be covering multiple different subjects throughout. Like I mentioned earlier, we do have the one on empathy. Whoops, the one on empathy tomorrow, and we are going to be joined with one of our fantastic trainers, Helen, and she will be talking about the how empathy and vulnerability in the healthcare industry, and some tricks and tips on how to manage that
Mhm.
with your team. So I hope everybody does join us tomorrow at 12:30 p.m. Eastern Time and to discuss about empathy. And we'll be happy to answer any questions that you may have regarding that presentation and this presentation as well. Sometimes it takes overnight to think about it, especially with all the topics that we covered today. And a lot of folks that I've spoken to over the years are, they're psychometrics is a new term, and
Mhm.
to completely understand it, how it can be used in the contact center industry and business, it takes time to see real use cases. And one of our follow-up webinars will actually talk about use cases and how we've seen success
Right.
using the
Yeah.
psychometrics as
Yeah.
well.
How to apply it and the results you can expect from it. But yeah, that's it's that new buzzword that's out right now. So we've got certainly some great content to deliver on that.
Yeah, and especially with the AI element, with the tech
Mhm,
element, because what we can find ourselves is falling down the proverbial hole of technology, and realizing, hey, we need to maybe pedal back and add that human element back in. And
mhm,
how do we do that? Well, psychometrics is a fantastic tool to do that.
to do that
To do
with.
that with, yeah.
Mhm.
So. Again, want to open it up if anybody has any comments, would like to share any of their experiences, if they're seeing something different within their contact center, or if they are seeing success with any topic that we may have not have mentioned during this webinar in the healthcare industry. All right. Well, I'll definitely, we thank you for joining us today. We enjoyed sharing the knowledge and
Mhm.
our experiences with you. Hopefully, you garnered something from it, and we can just build on it by you coming to the webinar tomorrow on
All
empathy.
right. Well, thanks
Awesome.
everybody.
Thank you.